Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. I'm joined today by our Medical Officer of Health, Dr. Lawrence Lowe, Paul Morrison, our Director of Bylaw Enforcement and Commissioner of Legislative Services, and Superintendent Sean Gormley from the Peel Regional Police, who is here to answer any questions. Wanted to start off with a transit update. There's been coverage over the fact we have diverted one of our routes, our Route 511, and let me just say we've done that out of an abundance of caution. Our local transit union, ATU 1573, I've got the greatest of respect for, and they were concerned about 3 transit operators who had tested positive in the last week on that route, and concerns over what the workplace outbreak in that area of the city means for their transit operators. I just want to say without hesitation that we will always put the health and safety of our operators first, and if there's any risk, no matter how insignificant that risk is, we're going to look out for our transit operators. They've been unsung pandemic heroes. If you look at the businesses that have been able to operate over the last year, essential businesses, they wouldn't have been able to. Canada's supply chain would have been in tatters if it wasn't for these transit operators that have been working day in and day out to get those workers to their essential places of work. And so I just want to say thank you to ATU. I want to say thank you to our transit operators, and know we're always going to have their back without hesitation. I want to give a bit of a vaccine update today. As of February 2021, there are 3 Peel Public Health COVID-19 vaccination centres in Brampton supporting vaccine delivery. At this time, we are continuing to support the vaccination of residents 80 years and older. The Region of Peel offices at 10 Peel Centre Drive is one of the venues. The Save Max Sports Centre, formerly known as the Brampton Sports Centre at 1495 Sandalwood Parkway, is another vaccine centre. And of course, Chris Gibson Recreation Centre, 125 McLaughlin Road, is another vaccine centre. Appointments are necessary. There are no walk-ins. The hours of operation will be dictated by vaccine supply. If it was up to me, we'd be running them 24/7, making sure that we vaccinate our seniors as soon as possible. But everything is dictated by vaccine supply, and so we are in that holding pattern. As vaccine supply comes in, we're getting them into the arms of our seniors, protecting our seniors. Appointments for those 80 and older in Brampton continue to be available, I would note, through the William Osler online booking system. For anyone with challenges for an online booking system, I have had some seniors calmly express challenges with that process. You can call the Region of Peel COVID-19 vaccination line at 905-791-5202 for assistance, and that phone line is open from 8 a.m. to 8 p.m. 7 days a week. I should also note later today the ministry will be announcing a pilot project that is going to make AstraZeneca available for a segment of our population, but you have to wait for the details from the ministry. But we're excited for that vaccine expansion as well for residents of Peel on a pilot project basis. In terms of testing, Dr. Naveed Mohammed and his team at Osler continue to do a tremendous job testing. Testing helps us identify where the virus is circulating. And I should note they've now completed 370,793 COVID-19 tests across their sites. And as of today, there's 25 COVID-19 patients at Brampton Civic, including 4 in ICU. There are an additional 18 COVID-19 suspect patients awaiting test results at Brampton Civic. And so our hospital capacity remains encouraging given where it was only a few months ago. As of today, Osler has administered 23,330 doses of the Pfizer BioNTech COVID-19 vaccine. That includes vaccinations to approximately 3,400 residents age 80 and older. Osler is now providing 1,100 vaccinations per day at the Brampton Civic Shinkuzi Wellness Center to high-priority populations under Phase 1 of the provincial vaccine rollout plan, including seniors at the age 80 and over, or those who will be turning 80 this year. On a bylaw update, Once again, we're seeing a high level of compliance, only 8 charges over the mandatory face covering bylaw, 7 charges under the Reopening of Ontario Act, and 2 charges under the Emergency Management and Civil Protection Act. The last thing I wanted to share with my update before we go to Dr. Lowe is I know we're going to see a provincial budget very soon. It's anticipated to be in the month of March. I just want to echo publicly what I've been saying privately to our provincial representatives. If there's one thing I'm looking for in this budget, it's to help us with our healthcare capacity. What this COVID-19 pandemic has shown that communities that are underserviced in healthcare will face a great strain. And, we talked for months about our hospital being over capacity. Well, our hospital was over capacity before the pandemic even started. The provincial average for beds versus the average for beds in Brampton is dramatically different. So we have half the beds per capita that is the provincial average. And so what I'm really hoping to see in this budget is an investment in our healthcare capacity, an investment in our ability to take care of our residents. And everyone knows that healthcare is administered on the provincial level, and so I'm really hoping. And we've been running a fair share campaign now for the last 2 years. We're really hoping that we're going to get a win for the residents of Brampton in this budget. And if there's ever an example of why you need fair and equitable healthcare capacity, it's been highlighted in strides during this pandemic. So on that note, I'm going to ask Dr. Lawrence Lowe to share his update from Peel Public Health.
Good morning. Thank you, Mr. Mayor. This week, Brampton's test positivity is at 6.5%, which is down from 8.7% last week. And Brampton's weekly incidence rate is at 124.4 cases per 100,000, which is flat from 128.1 cases per 100,000 last week. On Monday, we entered the provincial framework at the grey lockdown level as our vaccination rollout continues. And seniors born in 1941 or earlier are able to now book appointments through our Osler and Trillium sites, including the Trillium site at the University of Toronto, Mississauga. For more information on booking, you can visit peelregion.ca/COVID-19 vaccine. That's one word, COVID-19 vaccine. And I encourage everyone to reach out to 80-plus seniors that you may know in the community in case they need some help, a little assistance to book, or they can also call the Peel call center, as Mayor Brown mentioned as well, 905-791-5202. Please be patient because appointments are limited by supply. If you qualify for vaccine now but cannot access an appointment, please try again later. We are anticipating from our provincial partners that supply will improve in the coming weeks, but shortages limit the number of appointments, and they do limit them to the 2 hospital sites that we are that are currently operating. I really want to thank everyone else for continuing to patiently wait their turn and letting us direct our limited supply towards our oldest residents and also our frontline workers, frontline healthcare workers who are currently being vaccinated at the community mass vaccination clinics that Peel Public Health has set up. We now have opened 7 mass vaccination clinics in our region and started a limited pilot of mobile clinics as well in certain congregate living settings, and we are ready to go. We're ready to ramp up more appointments in our community vaccination clinics, and the sooner we get more vaccine, the sooner we'll be able to offer appointments to get more people protected. Certainly welcome the recent decision to extend second doses to 16 weeks. It allows us to get more people vaccinated sooner, and that hopefully means more quickly getting to community levels of protection that will keep our most vulnerable safe and also help us permanently unlock our community, as has been seen in other jurisdictions that have moved quickly on the vaccine rollout. It is hard to think that a year ago that the world changed so dramatically, and that Peel in particular would be harder hit than most other communities in Ontario and in Canada. I know that our businesses and our residents have bore the brunt and made sacrifices and have altered their lives and their livelihoods throughout this human health emergency. Unfortunately, stopping a human health emergency, a disease that spreads from person to person, means keeping people apart. And that was seen also 100 years ago, where the Spanish flu also shuttered businesses, prevented gatherings, and required the sick to self-isolate. And I know with all this that many of us are sick of the measures and the precautions, but we also know that the places that didn't implement measures saw the same impacts to the economy, they saw the same impacts to mental health and well-being, and the virus also spread out of control, which overwhelmed hospitals and resulted in significant mortality from COVID. So I want to be very clear that the measures that were taken here have saved so many, and because they have, we know that the voices of those that have borne the brunt grow increasingly, the voices of those that have borne the brunt of the disease grow increasingly faint as COVID fatigue starts to overwhelm us. And I want to be clear that I hear you. Yeah, I think all of our businesses, all of our residents deserve any and all support and relief to be provided for what has been sacrificed to keep our community and our province and country safe. But I want you to know that we have saved lives together, and without you, we would have lost so many more. And so right now, as we move into the hardest phase of the pandemic, I want to remind you, success is not reopening for the sake of reopening. Success is getting out of the pandemic for good, and I take that mandate seriously. So please know that better days are ahead. How soon they come will depend on how patient we can be, and no matter what, continue to limit contact, stay at home as much as you can, and get vaccinated when it's your turn. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. This now takes us to our questions. Courtney Hills from CP24.
Good morning. My question is for Dr. Lowe. It's a follow-up on some of the comments Mayor Brown made about the COVID cases connected to the Steeles bus route in Brampton. Peel Public Health hasn't declared an outbreak, so I'm wondering if you could share why that is, and has there been any change in the number of drivers who have tested positive?
So we continue an investigation into a cluster of cases that have been identified at Brampton Transit. At this point in time, we haven't identified any linkages between those cases that have been identified, nor with any specific outbreak in our community. At this time, our working hypothesis is that this reflects really a situation where you've got a lot of essential workers crowding onto transit, possibly questions around compliance, and ultimately really speaks to the situation that we have where you have high levels of community transmission and a very busy bus route, really just trying to understand what may have occurred, certainly with Steeles, but also with, throughout the Brampton Transit system. So that's why we have an ongoing investigation that's going on there at this point in time, but we have to remember that because we have such high levels of community transmission, because we have so many essential workers, this speaks to the need to continue to stick to the precautions. If you are sick, please stay home. And this is why we need paid sick days, because who knows, there's probably workers who are still sick, who are ending up on transit in crowded buses. Please make sure you're wearing a well-fitting mask when you're on transit. Please ensure that you're not removing your mask to eat or drink, and trying to distance as much as you can. So I think really we're looking at this as a means for us, and really in keeping the community safe and keeping transit safe, it's up to all of us to make sure we're following the precautions. Thanks for the question.
Thanks for the answer. I guess I'll just follow up on that. So the way I understand it, you're looking at the number of cases connected to this bus route and the large logistics facility. We're hearing it's Amazon. I know Public Health isn't naming the location, but you think these are two completely separate cases, that there is no potential connection between the employees who work there and the employees who would then get on that bus to go to and from work?
Well, like I said, we have high levels of community transmission. We have a number of outbreaks, and 511 Steeles, as I understand it from our hospital partner, from our transit partners rather, is one of the busiest routes in the city. And to the extent that the provenance and destination of passengers could be anywhere along that route, and it is one of the busiest routes in the city, we have not identified any specific link to any one specific outbreak at this time. Thanks.
Thank you. Courtney, I would note, I believe that logistics company has acknowledged the outbreak at their facility, and we're just going to we're not going to take any risk with Brampton Transit. When our local association A2U makes a request, we take it seriously, especially given the climate that we're in right now, where we've had 3 transit operators on that route test positive in the last week, and we've had 9 transit operators in the last month test positive. This is a frontline service that is keeping our supply chain in Canada intact, and the last thing we want is to see greater disruptions because of a spread amongst our transit operators. And just to highlight how being a transit operator is on the front lines and puts individuals in a precarious position. We have a transit operator right now who's in a medically induced coma fighting COVID-19, and so I don't want to diminish the risk and the sacrifice our transit operators take on behalf of the residents of Brampton every single day, and I thank them for their sacrifice. Our next question is Irene from 680 News.
My question is for Dr. Lowe. I'm wondering if there is any disappointment that Peel Region is not included in this week's rollout for the AstraZeneca shots, starting at pharmacies for those 60 to 64, because Peel has been such a hot spot, and I would imagine that there are many in the 60 to 64 range that might still be working.
Yeah, thanks for the question, Irene. I think when it comes to the vaccine rollout, information is changing day by day, hour by hour, and I believe in conversations with our ministry partners, they continue to figure out ways to get more vaccine to us in Peel, and I'm hopeful we'll have more news and perhaps some sort of an announcement soon, at least in respect to the AstraZeneca vaccine. Thanks for the question.
My follow-up, I'm not sure who would like to answer this one, but we're now into the third day in the gray zone. I'm wondering if there has been any concerns, any violations. How is it going?
So just one additional point on the AstraZeneca, I would say don't assume that we're not part of that pilot project. I want to respect the ministry's goal for making announcements. And just stay tuned. I believe you're going to hear some good news in regards to AstraZeneca and the pilot project in Peel very, very soon. In terms of challenges with the gray zone, no, we haven't had any bylaw complaints about compliance. And I would note it's very incremental from lockdown to gray, and so it's not like this is a broad reopening. The reopening has been incremental, and we haven't had challenges so far. Is there an additional question? Okay. Sabrina from Mississauga News.
Hi there. Thanks for the opportunity. My questions would be for Dr. Lowe. Doctor, as mentioned, we are in the third day of the gray reopening, and the weekend is fast approaching. We've seen in other regions there's sort of been overcrowding or long lineups waiting at certain businesses that have just reopened. I'm wondering if you have any concerns for that coming up.
Yeah, thanks for the question, Sabrina. It goes back to what I said in my remarks. The reality is our goal collectively is not to reopen for the sake of reopening and not to go back to living life the way it ought to be lived. I would like nothing better than that for myself, frankly, and for all of us. I think we all kind of want this to quietly go away. But I think to the extent that we are still seeing high levels of transmission, including, like I said, high levels of transmission that require us to, ensure that we are adhering to protective measures, especially on busy transit routes. Whether it's, boarding a bus, whether it's heading to the mall, whether it's whatever you might be doing this weekend, really ensure that you're limiting your time outside, limiting your contacts, making sure you're sticking to the precautions, wearing a well-fitting mask, all those other pieces, keeping your distance. We only need to really do this for just a little while longer, because when the weather warms up and we spend more time outside, and when the vaccines start to really roll, hopefully in the next few weeks, I think this will change, hopefully sooner rather than later. But for the time being, there's still a novel virus out there for which many people are not immune, and we just need to make sure that we're following the precautions as much as we can. Thanks for the question. Oh, and I think you had a follow-up.
Yes. So as you mentioned, the warmer weather. So are you concerned maybe that there will be more people heading out in warmer weather and sort of hanging out in larger numbers in parks or outdoor recreational facilities or anything like that?
Well, I think we saw throughout the summer and late spring last year that being outdoors actually helped to limit and reduce transmission. I think to the extent that people can make sure that they are distanced, that they are masked if they're meeting with people outside their household, and especially by the time the real warm weather gets here, hopefully vaccine coverage will have gotten to a level that will allow some of the measures to be lifted. We're essentially trying to dial back the measures while we increase vaccine coverage and hopefully get to some better weather in the spring. So I think outdoor transmission we know can be limited through very well through the precautions, and I just urge people to continue following the precautions as much as you can. Thanks so much.
Okay, our next question is Nikki Cedrone from the Bramptonist.
Hi, good morning. My question is for Dr. Lowe. when do you anticipate Peel Region moving into the red zone?
Thanks, Nikki. It's a great question, and I want to be very clear with everyone. I would like nothing better than to keep moving progressively down the color codes. I think our recent weekly numbers are starting to turn into a plateau. The question is, as you know, the piece around cases is that you need to have either stable or declining trends. So if things look stable, if things continue to remain favorable in our hospitals, et cetera, we may proceed. But again, it's really this tightrope between we're seeing more and more vaccine come available, which is really our way of getting out of this permanently, and we're really trying to just be careful and ginger on the measures so that we don't create a third wave, which would then essentially result in our vaccine capacity being diverted back to treatment and hospital capacity. So really precarious, walking a tightrope at this point in time, but hopeful and optimistic as always. Thanks, Nikki.
Thank you. One more question. Premier Ford said that they won't be able to control who gets the vaccines when it's open to the medically vulnerable. Does Peel have a plan to make sure medically compromised people get the vaccine first?
Okay, I'll have Dr. Lowe answer that.
Thank you, Mayor Brown. Thanks, Nikki, for the question. At this point in time, we have noted the ministry's phase 2 conditions that they've described, and we're carefully updating our own prioritization, and we'll be able to announce how that will work in the time to come. At this point in time, our program remains focused on the phase 1 rollout, especially for seniors over 80 and the very high and high-risk healthcare workers that have been identified. Thanks so much.
Okay, Nitin Chopra from Prime Asia TV.
Good morning, Mayor. Good morning to all. My question is to Superintendent Sean. Question is in terms of the protest happening every week in the city of Brampton. It's undoubtedly every week, either it was stay-at-home orders or a lockdown protests are there. Earlier, the police was passing, and bylaw was passing the buck on each other. Now, what has changed is police and bylaw working together so that no such incidents happen, which happened during the rallies in the past. No such incidents happen in the future. Also, there was a video viral, and there is a rumor that community is saying that there is no action by the police because the person, Jodhveer Dhaliwal, is connected to the high-level politician in the NDP. Is that only a rumor, or there is a fact into that? If you can clear that rumor also. Thank you.
Sure. So thank you for the question. So just to clarify, since the beginning of the pandemic, members of Peel Regional Police have been working very collaboratively with our partners at the City of Brampton, with our bylaw, as well as down in Mississauga with our Mississauga partners. As everyone is aware, there have been a number of incidents. There's been rallies, protests, varying incidents that have occurred in the past year. Generally, those are very difficult in policing to deal with, but certainly with the pandemic and some of the public health measures that are out there, it's been something we've had to factor in. This past weekend, we did have a very significant rally organized. We were aware of it ahead of time. We were able to stand up our proactive incident response team, and we're able to really ensure that we dealt with that in a very measured way. We are currently in the process of reviewing the video, looking at the evidence that we have. I do anticipate there will be some charges under the Reopening of Ontario Act. With respect to safety, there have been a number of incidents out there with respect to assaults and whatnot on various rally participants. We have made one arrest, and I do anticipate future arrests, although I can't comment on specific incidents. So thank you for the question.
Thank you. I have a follow-up for Paul Morrison, Bylaw Director. Paul, if you can also comment on the same question, and is bylaw and police working together so that no such incidents happen in the future, which happened in the past and there was a passing the buck? And also, in the past, we saw that many driving schools were operating in the city of Brampton without having registered with the city. And that time, city was committed to upload the approved or registered driving schools on their website. Is that done or still is pending, because that happened in 2020? Thank you.
Thank you for your questions, Nitin. I can tell you, and I can reinforce what Superintendent Gormley has said, we have been working collaboratively and proactively since the beginning of this pandemic. We exchange information, we look at the situations, we respond accordingly as best we can. as the superintendent has also said, these situations are very delicate to handle. There's a lot of people. We don't want them to turn aggressive or violent in any way, so they have to be handled very specifically and with measure. The charges will be coming, as the superintendent has said, and we will continue to work with our partners in the community that hold these protests. We encourage them not to do so. We encourage them to hold on until public health and Dr. Lowe have given us a better feeling that it's safer out there. And until those times come, we will continue to respond to the protests. Your second question, Nitin, thank you. Yes, we did commit to putting the driving schools up on our website, but we found with the pandemic, many of the service industries have been impacted greatly. As the mayor has continually advised the community, we have to rally and support. And in this case, what we're doing is we're waiting to see how many driving schools come back to the city and apply for licenses. April, May, and June are our license renewal times, so we'll have a better accounting of who wants to be a driving school within the city of Brampton, who can sustain their business within the city. So we'll be moving forward shortly with a list when we get that done in the next 30 to 45 days. Thank you.
Thank you, Paul. I just want to thank the Peel Police and Brampton Bylaw for their dedication throughout this pandemic. It hasn't been easy. They're on the front lines as well, and I know they're doing their best with the resources they have. And for any of the protests that are happening, let me just say I respect the fact there is a constitutional right, a charter right that gives people the right to peaceful assembly and the right to protest. But never in those instances should there be acts of violence. There is zero tolerance in violence, and I know hopefully that message has been heard loud and clear. And if there are future protests, let me be perfectly clear. I've heard this from Chief Nish. Violence will not be tolerated. We have time for one more question. Isaac Callahan.
Mayor Brown, my question is for you. Thank you for taking it. In 2019, your expenses listed $44,000 in legal costs for a cost that council had never had before. Can you tell me, please, what legal issues have you charged Brampton taxpayers for since you became mayor, and why are they not transparently listed online?
So that's a legal insurance plan the city has, not for myself, but in general for legal insurance. Thank you for the question. So that completes our COVID-19 update for this week. I remind everyone to stay safe and listen to the advice of Dr. Lawrence Lowe and Peel Public Health, and we look forward to updating you again next week.